start of the conference in about 3 minutes' time. Dr. Russell is going to be joined today by Health Minister Dorothy Shephard. If you watched yesterday, we heard for the first time from Greg McCallum, who is the Director of Emergency Measures, who is in charge of the vaccine rollout, which starts next week. I believe the vaccine is actually going to be in New Brunswick on December 14th, the first 1,950 doses. Now, the Pfizer vaccine, for anyone who is just getting familiar with it, I'll turn the volume down. They're just doing a roll call of some of the journalists who are late to the conference. The Pfizer vaccine is the first one that has been approved in Canada, and New Brunswick will be receiving 1,950 doses of it next week, but it is a 2-dose vaccine, so that means you get the first dose and then 3 weeks later, the second dose. Now, the first 1,950 doses will be the first dose given to 1,950 people, rather. And then the next batch will have the second dose for them 3 weeks' time from now. So I can give you a bit of a rundown on who is getting the vaccine first. So the priority group that's been identified to receive the vaccine first is long-term care staff and residents, staff from the provincial rapid outbreak management teams, and those are the people who respond to COVID-19 calls and outbreaks. Extramural ambulance New Brunswick staff, healthcare workers, First Nations nurses, and seniors who are 85 and over. So I don't know how that breakdown will work next week. We might hear a little bit more about that today, but I have a feeling today's conference will be dedicated to just looking at whatever the new case count happens to be for New Brunswick today. And again, I find out along with you. If we don't have a conference, I post that information on our Facebook page as soon as I receive it from the province. And I know many of you follow online. You can follow the case counts as they're updated online as well. So it's nice, though, to get the press release and have the breakdown of the age groups and the regions and whether they're travel related. And as soon as I have that information, I do update it on Facebook. But when there are days where we have conferences, I find out along with you in the conference. And Bruce did say we'd be starting on time today, so I have a feeling we're going to cut right to the conference. We're still waiting for the conference room to get set up, but it looks to be, if we are late, it's only going to be a few minutes late today. And again, if you're following on Facebook, I do appreciate the comments and questions that you post along with the video feed, because that's what's on my computer screen right now. I'm watching along with you online. I see it on TV as well. I've got both screens in front of me. So it is fun to follow along with the province and hear what your questions and concerns are and how you respond to the information. All the questions that I do ask in the conference come from conversations I've had with New Brunswickers about what they are living through and concerned about during the pandemic. So and if you would prefer to send them to me via email, you can email me at news@chco.tv as well, and I will get back to you by email, or you can message us directly on Facebook. But again, if there are conferences and you follow us on Facebook, or even if you watch on television, I will post as soon as I know on our Facebook page that there is going to be a conference and let you know what time it will be and that we'll be streaming it. It looks like we're about to get started. I can hear. I'm going to turn the volume up on the conference call, and that way we'll hear when Bruce gets started and we'll know to cut to the video feed of the conference room. But again, we will be hearing from Dr. Russell.
Good afternoon, everyone, and welcome to today's
Shephard
update
today.
on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honourable Dorothy Shephard, Minister of Health. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'Honorable Dorothy Shephard, Ministre de la Santé. Tout le monde a désactivé le son de vos micros. Please make sure you have muted your microphones. Can everybody please mute your microphones? Voulez-vous assurer de désactiver le son de vos micros, s'il vous plaît? Dr. Russell.
You sure everybody's muted there? You can still hear a little bit of... Somebody's not muted. Yeah.
Gilles, on peut t'attendre. Peux-tu fermer ton micro, s'il vous plaît? Merci. Dr. Russell.
Thank you very much. Merci, Bruce. Good afternoon. Bonjour à toutes et à tous. Aujourd'hui, je vous parlerai de la récente éclosion de la COVID-19 à l'hôpital régional d'Edmundston dans la zone 4 et des recommandations mises à jour sur le port du masque à l'extérieur, au service, à l'auto et dans les écoles. Avant de commencer mon rapport, toutefois, j'ai le regret de vous annoncer qu'une autre personne est décédée de la COVID-19 au Nouveau-Brunswick. Une personne âgée de 60 à 79 ans de la zone 4, soit la région d'Edmundston, est décédée aujourd'hui. Il s'agit du 8e décès lié à la COVID-19 dans notre province depuis le début de la pandémie. Cette triste nouvelle nous rappelle une fois de plus qu'au-delà des chiffres et des statistiques que nous évoquons lors des mises à jour, il y a des gens, des Néo-Brunswickois comme vous et moi, qui aiment profiter de la vie et qui avaient une famille et des amis qui les chérissaient. Je tiens à offrir mes plus sincères condoléances à la famille et aux proches de cette personne. Sachez que nous partageons tous votre peine. Before I begin my report, it is my sad duty to inform you that another New Brunswicker has died of COVID-19. An individual aged 60 to 69 years old in Zone 4, which is the Edmundston area, passed away today. This is the 8th death we have seen since the pandemic began from COVID-19. This reminds us once again that behind the numbers and the statistics that we cite at these briefings, there are people, fellow New Brunswickers who enjoyed life and love, with family and friends who cherished them. I offer my heartfelt sympathy to the family and loved ones of the deceased. Please know that we all share in the grief you are experiencing. As I have said many times, local outbreaks of COVID-19 are a fact of life in this pandemic and will be for months to come until we have a vaccine and the majority of New Brunswickers are immunized. When outbreaks happen, though, we will move swiftly to slow the spread of the disease and bring the outbreak under control, with your help, of course. That's what we have done in the Campbellton, Moncton, Fredericton, and St. John zones in recent weeks, and these efforts have proven successful. And I do want to acknowledge the ongoing work that so many people are doing for these outbreaks, day in, day out, and especially our regional medical officers of health. Again, they step up every single time in each region. So Dr. Kim Barker, Dr. Yves Legere, Dr. Marianne Paquette, and Dr. Nakoshi Lamptey, as well as our Deputy Chief Medical Officer of Health, Dr. Kristen Muick. Now we have an outbreak in Zone 4, and we are acting with the same resolve to limit its impact. Santé publique a recommandé au cabinet que la Zone 4 retourne en phase d'alerte orange du plan de rétablissement du Nouveau-Brunswick. Je sais que nous espérions que tout l'ensemble des régions de la province puissent demeurer en phase d'alerte jaune, en particulier à l'approche du temps des fêtes. Mais nous ne pouvons pas ignorer l'évolution de la situation dans la zone 4. The triggers for a move to the orange alert level are now present in Zone 4. We have seen a rapid increase in the number of cases over the past week, a doubling of case counts within 5 days, and a positivity rate from testing that is well above the provincial average. We also have an outbreak in a vulnerable setting, in this case, the Edmundston Regional Hospital. 7 members of the hospital staff have become infected, and at least 24 are currently self-isolating to limit the spread of the virus. This will impede the hospital's ability to respond should there be more cases requiring hospitalization. Cette situation pourrait nuire à la capacité de réagir de l'hôpital advenant qu'il y ait d'autres cas nécessitant une hospitalisation. Il y a également un risque important que le virus se propage de l'hôpital vers la collectivité. By moving to the orange alert level, we hope to slow the spread of the virus in the Edmundston area and enable the area's health providers to respond as needed. It is very important that everyone in Zone 4 adhere to public health directives as required under the orange alert level. And I also want to thank the local mayors and representatives and leaders of that zone. We just had a meeting just before I arrived to make sure that they were aware of the situation and trying to give them as much information as possible so that they can help inform residents as well. Wear a mask or face covering whenever you are outside your home, indoors and outdoors. If everyone joins us in the spirit of urgency, I believe we can limit the scope of this latest outbreak. Aujourd'hui, j'annonce qu'il y a 8 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Il y a 6 nouveaux cas dans la zone 4, soit la région d'Edmundston. Une personne âgée de 30 à 39 ans, une personne âgée de 40 à 49 ans, 3 personnes âgées de 50 à 59 ans, une personne âgée de 60 à 69 ans. Et ces nouveaux cas font présentement l'objet d'une enquête. Dans la zone 3, soit la région de Fredericton et du centre du Nouveau-Brunswick, il y a un nouveau cas à signaler, soit une personne âgée de 30 à 39 ans. Dans la zone 6, soit la région de Bathurst et la péninsule acadienne, il y a un nouveau cas à signaler, soit une personne âgée de 60 à 69 ans. Ces 2 nouveaux cas sont reliés à des voyages à l'extérieur de la province et ces personnes sont actuellement en auto-isolement. Il y a désormais 78 cas actifs de COVID-19 dans la province. 4 personnes sont présentement hospitalisées, dont 3 aux soins intensifs. Today, there are 8 new confirmed cases of COVID-19 in New Brunswick. In Zone 4, which is the Edmundston region, there are 6 new cases. 1 individual aged 30 to 39, 1 individual aged 40 to 49, 3 individuals aged 50 to 59, and 1 individual aged 60 to 69. These cases are currently under investigation. In Zone 3, which is Fredericton and Central New Brunswick, there is 1 new case in an individual aged 30 to 39. In Zone 6, which is the Bathurst region and the Acadian Peninsula, there is 1 new case in an individual aged 60 to 69. These 2 cases are both related to travel outside the province, and these individuals are currently self-isolating. There are now 78 active cases of COVID-19 in the province. 4 New Brunswickers are currently in hospital, with 3 requiring intensive care. Your thoughts and prayers provide comfort to these people and their families, so please continue to think of them as you go through your day. I want to speak to a change in our advice regarding masks outdoors and at drive-thru locations. We have determined that the risk of transmission in these circumstances is minimal, particularly when masks are not otherwise required out of doors. Communities at the orange and red alert levels will be required to wear a mask outdoors only in situations where 2 meters of physical distance cannot be maintained. Outdoor public spaces include parks, playgrounds, markets, festival sites, dog parks, and walking trails. Wearing a mask in indoor public spaces continues to be required in all alert levels. In zones at the yellow alert level, there will no longer be a requirement for customers to be masked at a drive-thru. Communities at the orange or red alert level would have to use a mask at a drive-thru because the directive mandates wearing a mask in any situation, indoors or outdoors, where 2 meters of physical distance cannot be maintained. Dans les zones en phase d'alerte jaune, les clients ne seront plus tenus de porter un masque lorsqu'ils utilisent le service à l'auto. Cependant, dans les zones en phase d'alerte orange et rouge, les clients doivent continuer de porter un masque dans ces situations, car le port du masque est exigé à l'intérieur comme à l'extérieur lorsqu'il est impossible de respecter l'éloignement sanitaire. Our collective experience clearly shows that wearing a mask and keeping physical distance limits the spread of the virus and therefore saves lives, along with all of the other measures, including our border measures, our gathering restrictions, etc. The actions that you take every day to slow the spread of COVID-19 have helped to spare our province from the worst effects of the second wave we are now experiencing. And if we continue to work together, protect ourselves and those around us, I'm confident that we can get through this and hopefully have a safe holiday season and New Year. Thank you very much.
Good afternoon, bonjour. Before I begin today, on behalf of all New Brunswickers, I want to extend sincere condolences to the family and friends of the person who died of complications related to COVID-19. You are in our thoughts and prayers at this very difficult time. Like all of you, we were excited to bring all of New Brunswick back to the yellow alert level yesterday. Unfortunately, due to the rising number of cases in Zone 4, the Edmundston region, we are unable to keep all regions in yellow. On the advice of Public Health, as of midnight tonight, Zone 4, the Edmundston region, will move to the orange alert level. I understand that today's news is not welcome, but it is necessary if we are going to limit the spread of COVID-19. While this is the first time residents of Zone 4 have been in the orange alert level since New Brunswick came out of lockdown, it is in fact the 7th time this has occurred in the province. The good news is that every time we have had to move a zone to orange, we have been able to quickly get the situation under control, and we are confident we will be able to do that in Zone 4. We will achieve this by working together and by following the directives of public health. That means wearing a mask as required, maintaining physical distance, and practicing proper hygiene. This week, some minor changes were made to the directives of what is required under the different recovery levels, and I want to highlight those for everyone. At the orange and red levels, masks have been mandatory in public places, both indoors and outdoors. However, masks are no longer required outdoors, providing that you can maintain 2 meters of distance. Throughout this pandemic, we have made changes as necessary to protect New Brunswickers, and we have done so based on the best information we have available at the time. When the alert levels were first developed, we needed to ensure that we could stop any potential spread of the virus quickly. Requiring residents to wear masks in public, indoors and outdoor spaces at the orange level was an additional measure that we applied. We have since learned that if a person is outdoors and is able to maintain physical distancing, the risk of transmission of the virus is low, and therefore a mask is not required. But if you are in an outdoor space and you aren't sure you will be able to maintain 2 meters of physical distance at all times, please wear a mask. At the orange and red levels, face masks are required when accessing goods through a drive-through window. However, face masks are no longer required when accessing a drive-through in regions at the yellow alert level. This change was made because we have assessed the risk level to be low. And if you're more comfortable wearing a mask at a drive-through, please do so. Every extra additional prevention method you can do is going to benefit you, especially throughout this holiday season. More details on what is required at all alert levels can be found on the coronavirus page on the GNB website. While some things have changed, it is important to know that the self-isolation rules for anyone coming to New Brunswick have not changed and will not be changing before Christmas. Christmas is 2 weeks away from today. If you are not already in New Brunswick and self-isolating, you should not be opening presents with your family on Christmas morning, nor should you be having Christmas dinner with your family on that day. The risk is high. Months ago, we kept COVID-19 out of our province, but COVID-19 is now all around us. More than 90% of the COVID-19 cases in New Brunswick are travel-related. If you don't follow the rules, if you don't self-isolate for 14 days as required, we could have surges of cases in January, and most likely will. Today's update serves as a reminder that the virus is still with us, and that given the opportunity, it will spread quickly. Now is not the time to get complacent. There is a light at the end of the tunnel, but we're not quite there yet. No matter what zone you are in, I urge you to continue to take precautions in the days ahead and follow the directives of public health. Working together, we can ensure that all New Brunswickers have a safe and healthy holiday season. Thank you. Merci.
Merci, Ministre Shephard et Dr. Russell. Thank you, Dr. Russell and Minister Shephard. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question et un suivi. We'll now proceed with questions from members of the media. Each reporter will have one question and a follow-up question. You have the right to pose your question in the language of your choice. Voulez-vous assurer de désactiver le son de vos micros? Please ensure your microphones are placed on mute. Travis Fortnum, Global TV.
Hi, my question might be best posed to Dr. Russell. Of the at least 24 staff at the Edmundston Regional Hospital who are self-isolating, I'm wondering if you can tell us how many of those are healthcare workers.
My understanding is the people who are self-isolating at the moment are healthcare workers. I don't have any further details on that.
Mr. Fortnum, do you have a follow-up today?
Yeah, so is the province moving any healthcare workers from elsewhere in the province to help at that hospital, or?
I can let you know that Vitalite has been moving resources around from the hospitals in the northern region, and they have been addressing this since this morning.
Thank you, Mr. Fortnum. Thank you, Doctor. Thank you, Mr. Shephard. Laura Brown, CTV.
Hi there, Dr. Russell. I'm wondering if you have sort of made any connection with the source of this outbreak. And by that I mean before in interviews you have said you felt confident that despite things were still under investigation, you felt confident it was still going to be connected to travel. I'm wondering if you fear community transmission in these cases.
No, not at all. Thank goodness. Our teams have been working really closely with respect to the cases and contact tracing. What's happened with this particular zone is there are 2 clusters, and each cluster is traced back to travel.
Thank you, Dr. Ms. Brown. Do you have a follow-up?
Can you tell us the status of the others that are in hospital at this time?
Well, all I can tell you is that there are people in intensive care, and obviously that's very serious, so we'll have to wait and see in terms of how things continue to go, but just keep them in your thoughts and prayers.
Thank you, Ms. Brown. Thank you, Doctor. Jean-Philippe Hugues, Radio-Canada.
Oui, bonjour. J'aimerais savoir, parmi les nouveaux cas de la zone 4, combien d'entre eux sont des professionnels de la santé?
Are we breaking it down? Je l'avais. Allô, Jean-Philippe, on a cette information, je ne l'ai pas devant moi. Je vais juste vérifier si c'est le cas, mais parce qu'il y avait un groupe de cas actifs qui étaient des travailleurs de santé et il y en avait qui c'était des patients. Mais le nombre en total, j'ai pas les nombres en total, mais je peux les donner à Bruce après si tu veux le rejoindre.
Est-ce que je pourrais savoir, oui, j'aimerais ça, mais est-ce que je pourrais savoir, les cas de la zone 4 sont-ils tous des patients et des travailleurs de la santé?
Non, parce que, à ce moment-ci, je peux seulement dire que généralement, ça serait oui, mais sauf que je sais, il y a une école qui est impliquée, mais je ne sais pas si c'est parce que c'est un contact étroit ou est-ce que c'est parce que c'est un cas. Je sais qu'il y avait une garderie qui est impliquée et aussi une école, mais je ne sais pas si c'est parce qu'il y avait un cas ou un contact étroit. À ce moment-ci, je crois que c'est un contact étroit, alors mais je vais confirmer et Bruce va donner l'information.
OK. J'ai un follow-up aussi. le syndicat des infirmières du Nouveau-Brunswick a écrit un communiqué dans lequel ils disent que c'est décevant de constater que des leçons n'ont pas été tirées de la première vague pour assurer la sécurité de leurs membres. J'aimerais savoir qu'est-ce qui a changé ou qui n'a pas changé dans le travail du personnel de soins pour les protéger contre la COVID-19.
Alors, pour les vaccins, tu veux dire?
Non, les protéger pour pas qu'ils soient infectés, par exemple, comme on peut le constater à l'hôpital d'Edmundston. Le syndicat dit que les leçons n'ont pas été tirées de la première vague de COVID-19. Qu'est-ce que vous avez à dire à ça?
Je comprends pas la question. Je crois pas que je peux entendre comme il faut.
Je vais répéter, je suis désolé. Le syndicat des infirmières du Nouveau-Brunswick désole que les leçons n'ont pas été tirées de la première vague. Il n'y a pas eu d'apprentissage. Les choses n'ont pas changé.
Ah,
pour
OK.
la sécurité des infirmières, la sécurité du personnel dans les hôpitaux.
OK, là, je comprends.
Est-ce que vous êtes d'accord que les choses n'ont pas changé entre la première et la deuxième vague?
Non, je suis pas d'accord avec ça. Non, je suis pas d'accord du tout. Je sais qu'avec les deux réseaux, ils ont fait beaucoup d'engagement avec les infirmières, tous les travailleurs de santé au niveau des protocoles pour les infections protocoles. Alors, je crois que même à Edmundston, je crois, l'information que j'ai, c'est qu'il vient juste d'avoir une en anglais, refresher. Tous les travailleurs de santé dans l'hôpital viennent juste d'avoir un cours pour essayer de leur rappeler de comment faire tous les protocoles contre l'infection.
Merci, M. Hugh. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, we know that the vaccine protects against symptomatic COVID-19, but do we know yet if the vaccine prevents transmission entirely? Can a vaccinated person still potentially spread COVID-19 to other people?
So the jury's still out on that. So that's why while we undergo the rolling out of the vaccination program, we will be getting more information as more people are vaccinated, and we can see some of the surveillance data on that. So it's not known yet exactly what kind of protection people will have. And so until we get more information, then we'll have to just continue to vaccinate people and assume that there is still a risk, and we'll still be asking everyone to follow the same public health protocols and measures.
Ms. Hogarth, do you have a follow-up?
I do. It's just a quick one. I'm just wondering if the first person to get the vaccine in New Brunswick has been chosen.
No. Not yet.
Thank you.
Thank you, Ms. Hogarth. Tom Bateman, Times and Transcript.
Hi there. I think this is for Dr. Russell. I just wonder if the prospect of Zone 4 celebrating Christmas in the yellow phase of COVID protocol is now out of question now that we're exactly 2 weeks away from Christmas.
Well, I won't never say never. We have to follow along and see what happens. I think if everybody digs deep and we go hard at trying to contain this really, really quickly, then I think all we can do is do our best at this point in time and see how things go. But obviously, with all of the other outbreaks we've had, for the most part, it has taken 2 weeks, but in some cases it was less, some cases it was more. So we're just going to have to do everything we can with all of the resources we have and the cooperation and of our citizens and everybody in those communities to pull together, and we'll see what we can do all together.
Thank you, Doctor. Mr. Bateman, do you have a follow-up today?
Yes, thank you again for the doctor. Exactly what new evidence became available to you and your staff to inform the change in guidance on masks? I think, the indoor-outdoor or the outdoor wearing of masks is one of the more confusing things for lots of people. So what's made this change happen?
So you're talking about outdoor spaces in the orange phase and masks? Compliance.
Yeah, or what informs the change that you announced today?
I'm going to let Minister Shephard reply.
Great.
So I think I can address that by saying compliance. It became, early on before we had mandatory masks, it was very difficult to get people to understand the importance of masks and to have high compliance rates. Now we have extremely high compliance rates and people understand the importance not only of masking, but of that 6-foot distance and of the precautions that they need to take at all times, hand washing, that kind of thing. So as the public has become more helpful in us keeping this at bay, we have been able to see that some restrictions just are not necessary. And so at the beginning, when we were seeing people congregating in parks and it was an outdoor place and it was nice and safe feeling for them, they didn't mask. And so that was why we went to mandatory masks, because we needed that compliance effort to be much higher. We have that now, and people are really very used to wearing their masks. So now in outdoor spaces, they know if they're walking their dog in the park, we're not expecting them to have a mask on unless they're going to stop and talk with people along the way. If you can't maintain 6 feet, we want you to wear a mask. But we think now people are understanding, after all of our months of going through this, are understanding how helpful they can be by doing this.
Thank you, Minister. Thank you, Mr. Bateman. Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, based on the number of healthcare workers involved and the fact that this outbreak is at the hospital, what are your projections telling you at this point? How bad could this get?
Well, our assessment team is made up of representatives from Vitalité and Horizon, and so when they're looking at their staff in terms of who has to be off because of either being infected or because they're self-isolated, they are the ones that are looking at the resources at this point in time. From a public health perspective, we were concerned about the capacity, and so they were informing us of the impacts that the staff was having in terms of how they can operate the ICU, et cetera, and have admissions and the emergency department. So as of right now, all the staff and the patients are going to be repeatedly tested, just like any of the outbreaks that we've seen in long-term care facilities. So that's going to be going on for the next several days. So every couple of days they'll be tested, and we'll keep an eye on that. But certainly it has impacted their capacity, which was one of the triggers for going to orange. And obviously being able to manage this quickly will obviously have a positive impact, hopefully, in terms of turning things around sooner rather than later.
Thank you, Dr. Ms. McKinnon. Do you have a follow-up today? Ms. McKinnon?
Sorry, I was still on mute.
That's allowed.
Yes, getting back to vaccines, we know 1,950 people from the priority groups outlined yesterday will be the first to get the vaccine, and we know that they have to be able to travel to the Miramichi Hospital to get the vaccine because of its cold storage demands. But beyond that, Dr. Russell or Minister Shephard, could you please explain how those individuals will be selected? Will it be, for example, through a random draw or of Medicare numbers?
So I can share with you that because this 1,950 vaccine doses will be limited to an area, we have carefully calculated the numbers of those who are in the nursing home and the employees that work there. And we know that they're going to take up approximately, I think it's approximately like 40 to 45% of the doses that are available. And then, of course, we'll go on to the other sectors. So it's, we've been talking with Shanax. They're very cooperative, and they are going to make arrangements for anyone who is able to come to the hospital, to the clinic, to receive their vaccinations.
Thank you, Ms. McKinnon. Gilles Duval, CMT.
Oui, bonjour. Oui, ce serait pour Dr. Russell, à savoir, je crois que tout à l'heure, on a enfin parlé du cas numéro 1, là, ici, pour la deuxième vague.
Je crois qu'on a dit que c'était relié à un voyage. Alors, ce serait pour savoir si on a pu déterminer si cette personne-là avait fait son processus d'auto-isolement et est-ce que cette personne-là avait cessé ses activités peut-être avec sa famille et son entourage ou tous les gens ont continué à se promener dans la communauté, ce qui fait que c'est peut-être ce qui a propagé le virus, là.
Alors, juste pour confirmer que les deux cas indexent, parce qu'il y a l'éclosion à deux parties. Alors, chaque partie de l'éclosion à zone 4 est liée au voyage. Mais pour les raisons de confidentialité, je ne vais pas vraiment mentionner tous les autres détails. C'est encore sous une enquête et l'investigation va continuer. Mais pour la confidentialité à ce moment-ci, je ne veux vraiment pas donner plus de détails. Sauf qu'il n'y a pas de transmission communautaire, c'est lié au voyage.
Monsieur Duval, as-tu un suivi cet après-midi?
Oui, simplement pour savoir, nous, on a comme entendu parler qu'il y aurait au moins 2 écoles là, qui auraient des cas ici, là, une francophone, une anglophone. Est-ce que vous avez cette information-là ou c'est pas rentré encore là, concernant les écoles, pour préciser, s'il vous plaît?
L'information la plus récente que moi j'avais reçue, c'était qu'il y avait une école impliquée et une garderie peut-être. Mais je n'ai pas entendu l'information sur une autre école encore.
Bien, merci beaucoup.
Merci.
Merci, Monsieur Duval. Merci, Dr. Jordan Gill, CBC.
Yes, I guess this is for either Dr. Russell or Mr. Shephard. The boundaries of the St. John and Fredericton regions were recently changed. Are any changes being considered for the Edmundston region, even if only temporarily, to allow those who live far away from the center of the outbreak to celebrate the holidays with their family and friends?
So public safety has been working with public health on trying to identify communities of interest so that we can, minimize but stay within safety regions. There was already a change in the Edmundston region with Keswick and Saint-Quentin, I believe, and so they are now in Zone 4. They will remain in Zone 4. Outlying areas still get their services from the more urban areas, and it is important that we're all in this together. So if Zone 4 is under orange, then everyone included in Zone 4 will be orange as well, unless we have determined to make changes on the map. And public safety will actually be updating government on that in the days coming.
Thank you. Mr. Gill, do you have a follow-up?
Yes, I do, and this is also for Mr. Shephard. What was your role in the Atholville Special Care Home deal that exempted it from following the staff ratios set out in provincial regulations? Did you sign off on it, and what provisions were there to check in over the course of that year-long pilot?
So I don't have all of the information here with me today, but I will tell you that I was Minister of Social Development when that pilot project began. It actually started under the previous government, but we all have a role to play in our positions that we do. We are a government who has always said that we would be very proactive in trying to address our staff shortages. But this was about innovation. This was about a company who felt that technology could help in a special care home where clinical services are not necessary. And so that was my role. I was Minister of the Day.
Thank you, Mr. Gill. Thank you, Minister Shephard. Sarah Seeley, Times and Transcript.
My question is for Dr. Russell. I was wondering if there was a significant number of asymptomatic carriers with the Zone 4 outbreak.
So I don't have the breakdown in terms of the test results right now that were from asymptomatic or symptomatic people, but I do know that, in every outbreak, there are people who are pre-symptomatic and asymptomatic, especially in younger populations. So, but I don't have a breakdown in this particular case. But certainly the transmission of COVID in a community is very serious, and so we don't have community transmission at this point, but the quicker that we get this under control by having gone to orange, the better.
Ms. Seeley, do you have a follow-up?
Yes, it's also for Dr. Russell. I was wondering if, given the number of cases in the hospital, if additional safety measures beyond what's already in place might be required.
My understanding is that Vitalite is working with public health and the IPC folks to make sure that everything that needs to be done is being done. So I know that Vitalite has offered testing for asymptomatic employees over the next 3 days. And separate from that, they've changed what services they're able to offer right now. They've changed their visitation with respect to only allowing people to visit for pregnancy, palliative, and pediatrics, I believe. And they're recommending that you don't go to the emergency department unless you have a very, very urgent medical problem.
Thank you, Ms. Seeley. Thank you, Doctor.
That concludes today's COVID-19 update for New Brunswick with Dr. Jennifer Russell and Minister Shephard. Just to recap, there were 8 new cases of COVID-19 in the province today. 6 were in the Edmundston region, that's Zone 4. There was another case in the Fredericton region, as well as 1 in the Bathurst region. And due to an outbreak at the Edmundston Regional Hospital, the Edmundston region, that's Zone 4, will be rolling back to the orange level of recovery at midnight tonight. There was also the 8th death reported in New Brunswick. That's over the course of the pandemic. I'll be joining you again next week, and I will notify you on Facebook when our next conference is scheduled.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.